Welcome to Phoenix and Flame, my podcast about pushing through and transforming even when you feel like a pile of ash. I'm Dana Skaggs, a psychotherapist known as the Queen of Boundaries. If you are new to Phoenix and Flame, please subscribe so you will be notified of new episodes. Visit Dana Skaggs, DanaSkaggs.com for a free quiz to discover how boundaries are impacting your life. This podcast is not intended as psychotherapy. If you are in crisis, please call 911 or contact your local crisis hotline. Welcome to Phoenix and Flame, my friends. Joining us today is Dr. Stephan Neff. He is a doctor and has also been a patient. He has experienced trauma, depression, anxiety, PTSD, and addiction firsthand. And he is also determined to help others make sense of their emotions and experiences. Dr. Stephan Neff, welcome to Phoenix and Flame.
It's an absolute honor and privilege to be here. Thank you so much, Dana.
This is wonderful. We're going to have a great conversation. Now, I want to share just a little bit more about you with the listeners. You were born in Germany, and you have studied medicine at the prestigious Heidelberg University before traveling and working around the globe. Nowadays, you have settled down as an anesthetist in New Zealand and has become a best-selling author and advocate for mental health and addiction. That's wonderful.
Thank you. It's just, sometimes we are born into lives where maybe they don't end up the way that we like them to be. So unfortunately, I had more than my fair share of trauma. And some of the traumas were just very brutal. I mean, when I was 13, I was the victim of a gang assault. Just wrong place, wrong time. But it changed my life forever. It really switched on a very dark period of time, and that was the 70s. So PTSD was not really well recognized.
Right.
Or well, it was maybe in soldiers. Even then, it was poorly treated. So there was certainly no attempt of any, I don't know, mental, emotional support of sorts. Instead, still bruised, I started studying martial arts and became very obsessed with that. So out of this 13-year-old, maybe a little bit pudgy teenager, became Rambo, basically. I became the fighting machine. And for 5 years, I did exactly that. So during the day, I would study at school. Then after our jobs, because I come from a poor background, and then I would train 4 hours or so martial arts, and that was my life. And my body turned, and it was really, I became quite a specimen and became a good fighter. So that was good. But I mean, at some stage, I had brought the gang leader behind bars, so he threatened to kill me as soon as he gets out and those kind of things. So there was always that kind of overhang, and because he had knocked out the front teeth, and when you're a teenager, you don't get permanent caps and permanent resolutions. You get kind of weird stuff that from now and then falls out. You can imagine what that does to a teenager's soul. I mean, there was not a laughter, nothing positive. There was no joy. There was nothing. There was just pure survival. And it was okay. And in my mind, I created that construct of I'm the man, and there's no one will help me. When I was beaten up, and it was the train came, and that was actually the moment that the assault stopped. And I went into the train and had to go past the driver and past some people. No one helped me, and everyone looked away. And it was that from that moment on, there was this core belief: I'm alone. If I don't do it, no one will ever help me. And that core belief is, however warped it is, was of course there. And that also later on then prevented me maybe from seeking the help and the assistance that could have maybe helped me, could have maybe improved me in ways that I couldn't even imagine. But they were sort of serious warped core beliefs laid down in my childhood at the time of the assault and then later on. And then I went into university. So after 5 years, thereabouts, university. And there was this one Saturday when I sat with two friends in a German beer garden. And it was one of these beautiful summer days, and it was warm, and we were sitting under this huge oak. And we both had, it was Saturday lunchtime ish. We had a stein of beer, so a liter of beer, and most of it was gone. And suddenly I heard this laughter. And I thought, around, where's this coming from? And I realized it was coming out of me. There was this belly laughter full of joy, full of dopamine rushing over me because I'd realized that this guy will never find me. I was in a different town. It was time before internet. I realized that I was with friends, that I could actually relax. And there was this beautiful thing called alcohol that was
Mm.
suddenly releasing my inhibition. And I was laughing,
Mhm.
and it was such a beautiful memory. It forever got deeply chiseled into my brain. Alcohol is good, yeah. And so there you go. And alcohol became a friend for the next years. But it was also my only friend as far as coping mechanisms was concerned. There was me working hard and escaping my reality through studies and working hard in a mental way. And with hindsight, I think I became a workaholic long before I became an alcoholic. So it was another way of escaping.
Let me ask you something
Should.
really quickly because I heard you say something that resonated with me. And since I'm a psychotherapist, I've heard lots and lots of stories. And so it's a privilege to be able to hear people's experiences in the office because it's confidential. There's no judgment going on. They feel perfectly comfortable and safe, and they are safe, to be honest. And so it is indeed a privilege that I've had over 16, 17 years to be able to hear these stories. And you hit upon something that I have heard before, I've experienced it myself. It's the narrative, the core belief of, "I'm alone, no one will help me." And I'm wondering your thoughts on how when someone develops that narrative, that core belief, and then they sometimes stumble upon a substance, whether it's alcohol or some form of a drug, and they feel like that is my friend. That is what I can count on. That is what I can lean on. I can't trust anybody else, but I can trust this substance to always be there for me, to bring me out of my doldrums, to protect me, to it's not going anywhere. I can always get access to it. I'm wondering what your memories are and what your thoughts and feelings are about that particular leg of your journey.
Absolutely. It is, the alcohol has become a friend, or had become a friend then. And it had many advantages. I was shy.
Mhm.
It disinhibited me. I'm probably not the greatest singer, but hell, give me a few drinks, the guitar comes out, and out goes the songs. And you can imagine that you had this actually rather good looking, really trimmed man who was just didn't give a damn. And it was like moths to a flame. Women would just choosh, choosh,
Mhm.
choosh. But equally, I was I was warped equally in my core beliefs there because my stepfather had brought me up that a good man, he beds as many women as you possibly can, and that is the real macho kind of thing. So I was brought up in that kind of environment, and I became very good in that too. So it
Mhm.
was it was a very weird time. I think I was pretty broken, and many other people out there are just as broken, but we try our best under the circumstances, and we
Mhm.
we need to realize that at that moment in time, however warped these beliefs are, however really bizarre these thought constructs are, they are there for a reason because they protect us. They are there to give
Mm,
us the hug the inner child that we actually probably needed rather than anything else. Even
mhm,
nowadays, it is so important, that hug. Now, at the moment, I'm going through a divorce, and my gorgeous two boys have left the house, so I'm physically alone here. And I nowadays have recognized the importance of my love languages and my needs. So I find myself at times
mhm,
literally standing there, giving myself a deep hug, holding that hug for 20, 30 seconds, and give that inner child in me a hug and say, Stefan, it's going to be all right. Okay. And that is
mhm.
probably what I really would have needed in the past, but I didn't have it. And the alcohol replaced that. So the alcohol or whatever other things people use, initially prescription opiates that then lead to intravenous or street recreational drugs, the gambling, the pornography, the food addictions, all them,
Mhm.
they are there to protect us. They serve a reason, and that is the problem. If you just go, Nancy Reagan, just don't do it, like the 80s, yeah, about that. That will not work so well. Okay, so therefore, no, no, no. We need to work on the underlying causes. Okay.
That reminds me, have you ever seen the Bob Newhart, um, snippet, the video where he screams at them, "Stop it!" Have you ever seen that
Negative,
before?
negative. No.
If you have not seen it, and listeners, if you have not seen this, you have absolutely got to go on YouTube and type in, I think was Bob Newhart, just stop it. And he basically has patients coming to him and they're paying him this money and he just screams at them, "Stop it." Like, oh, okay. I wish I had thought of
Yeah,
that. But
exactly.
you bring up an excellent your points of these defense mechanisms, I think, are really crucial because we get caught up in a shame
Mm,
spiral and that causes us to be very secretive because we're ashamed. But if we realize that these younger parts of ourselves, their defense mechanisms were designed to help us, even though they turned out to be somewhat dysfunctional, it was all our younger selves knew how to do. Like
exactly.
you said, most of us we're just trying the best that we can. We're trying the best that we can. And so sometimes the things that we're choosing does end up causing us more problems down the road. But when we
Mm,
understand that those parts of ourselves actually are trying to protect us, then we can kind of step out of the shame spiral and be more open
indeed,
and accepting
indeed.
of ourselves.
And I must say that the shame and guilt, they are all part and parcel of a journey, because we are doing things that we are not proud of, and we need to accept that. So there is, when people say, forget the past, look forward into the future. Yes and no. You need to look into the past to learn the lessons from there. You need to reconcile. You need to make amends, because only then, by actually looking at the multiple traumas that you have gone through, and with some experienced help, start to take one little trauma or a big trauma, whatever you feel right, actually have a look at that and unpack it and
Mhm,
deal with
mhm.
it, and then say thank you very much, trauma, for the lessons that you have taught me. And yes, it was a really shitty time, but enough is enough now, and now let's put this baby to bed. Woof. And if you can
Absolutely.
do that over a period of months, years, with the majority of your life, but the past life, whilst you are at the same token creating habits that give you a purpose, that give you a feeling of increased self-confidence, where you start looking after your nutrition, where you start looking after your physical body, where you're looking after your spiritual, after your emotional sides. where you learn about love languages, where you practice them in daily life, where you create habits that focus on consistent improvement in all the pillars of your life. When you actually practice
Mhm.
that every day, then it is inevitable that you become a better human. And it is inevitable for you to heal. That is not to say that there will not be new trauma waiting just around the corner. I think, rest assured, if you think that however much you have figured out your life, don't you worry. The gods in the pantheon up there, they're just looking down and saying, look at her. Look, Dana, she thinks she's got it sorted. Ah, come on. What should we do? What should we do? Okay, chicken pox. Nah,
Yeah.
she's had chicken pox. What else can we throw there? Okay, monkey scabies or something like that. Yeah, okay, yeah, that's cool. We give her that.
That's hysterical.
Yeah,
You are absolutely you're hitting the nail on the head on so many levels because I think people are afraid to address their traumas for obvious reasons because therein lies pain. But the option, we either go back and face these areas of trauma and feel what we need to feel and process that and deconstruct it, challenge the narratives and then reconstruct it.
absolutely.
Then if we can't do that, if we're just running away, I told somebody one time, I said, what we avoid, we feed. And so if we spend our time avoiding, you're actually it's not getting smaller, it's getting
True.
stronger. And so the best thing to do is to go back exactly how you're so, adeptly describing is address those
Mhm.
traumas, go back, create
Mhm.
space to face those things and realize you can feel the pain. No, it's not going to be comfortable. No, but what's the option, right? Running your entire life. I talk to people about feeling like there's like you're running and you're running like there's this monster running behind you and you can feel it breathing its hot breath on the back of your neck,
Mhm.
blowing your hair
Mhm.
forward. It's like you're either going to do that your whole life with this monster breath on your
Mhm.
back, or you're going to just dig in your heels into the dirt and you're going to whip around and grab the monster by its ears and pull it in and go, what do you got? Because I'm tired of running,
Mhm.
right? Just bring it in because I can't run my whole life. But I think a lots of times we try that and we use
Mhm.
substances to help us run. But what we avoid, we feed.
And there are so many substances or behaviors that can be used. Some of them are not so well appreciated, liked. Some are openly hated, like the real hard drugs. But then again, if you look at workaholics and people
Hmm.
who spend
Yep.
16 hours a day in their business, the disease of being self-employed, then that is thought in our society, wow, brilliant here, self-made human. She
Hmm.
is going out there. Well done. When in reality, it is just the same escape mechanism because you're running away. You're trying to get
Yes.
away from that monster, and that monster keeps coming
Yes.
back. So therefore, I
Hmm.
think that is the biggest lesson that I think I want to share with people. I want to share that really the past does not equal the future. There is hope out there, and that there are all the mental health problems that you can imagine, from addiction to depression to other challenges. All of them lie to you. They're big, fat, ugly liars.
Hmm.
Okay,
Hmm.
there is
Yep.
help, there is hope, but you can't see it. You can't see it when you're in the darkness. And I think that is the
Hmm.
important bit. There are people out there who have gone through the same as you have. And that was another thing that I could have never imagined. 10 years ago, 11 years ago now, I ended up in inpatient rehab because my traumas, they had just gone bigger, bigger, bigger. And so had my alcohol consumption. And luckily, at that time, my wife supported me hugely, and she helped me behind my back organize an inpatient admission. And it was there that I stopped using uh, alcohol to run away, my work to run away. I was now forced to address some of the issues. And I thought I was alone. And in reality, chemical addiction at least affects 1 in 4. If we look out
Whoa.
there, then depression, your lifetime chance of having depression is 1 in 3. There are so many cases of PTSD that are not completely undiagnosed, yet have wreaked
Mm-hmm.
havoc. There are so
Yep.
many childhood traumas, adverse childhood experiences, and many of us don't realize that we had them. Yet when you actually expose yourself to an ACE test, then suddenly you realize, oh my God, I'm scoring 6, 8, and 10. Oops. Anything more than 4 is considered you being clearly at much increased risk of anything from poor
Mm-hmm.
health to really then the addictions, the mental health problems, etc. So we don't realize that this is there. We take it for granted. If you're living in a burning house, then you think, oh, that's nice and warm over there. Yeah, that's nice. Warm my hands there. When in reality, the wall is on fire. Okay, because you don't know differently.
Right.
And the moment you're actually beginning to realize really what has occurred in your life, what are the flow-on effects, and what were the behaviors that you, for example, never trust anyone because trust has been broken so many times in your childhood, that you constantly seek reassurance, external validation, this kind of people pleasing, because you have been so attuned to making other people happy. The sheer fact that you have got this constantly heightened awareness of what is happening around you, because in the past you needed to have that to survive. It's those kind of
Mm-hmm.
flow-on effects that are lingering and that need to be addressed. And that is happening in a modern, lovely life that I'm striving to live. That is happening in rehab, and you get initially introduced to that in a good rehab, that is. Um, that is happening even if you have not yet succumbed to not so nice coping mechanisms, but you realize I'm actually unhappy in my life. Why am I so unhappy? I'm achieving everything and then some. I've got more alphabet soup behind my name than I care to remember, yet I'm unhappy. Why is that?
Mm-hmm.
There are so many
Mm-hmm.
reasons there, and I think I found that the same thing. So I still have many of these flow-on effects from childhood or from all the trauma in my life. I'm awful in stopping and congratulating myself, celebrating my wins. That's still, oh my God, it is. I have to force myself to do so because I expect 120% still. I expect myself to be the man. And I can achieve tremendous things, and I have achieved tremendous things in my life. Yet they often don't give me the joy. And I just tick them off. Okay, great. Another title or another certification, whatever it is. Whilst nowadays I force myself to say, stop, you look what you've just done. Others have crumbled
Mm-hmm.
whilst you have grown under these circumstances. Stop, give
And that
yourself a
is
hug.
fabulous.
Oh,
Yes, that's it. To be able to do that and acknowledge, and I call them basking
mm,
moments, to stop and to be able to do
mm,
that. I've got a
mm,
question for you, Stephen. So, if someone is listening and they are on this journey and they're struggling with any one of the number of defense mechanisms that you've pointed out, various addictions and these
mm,
types of things, we both know that a lot of times secrecy is kind of wrapped around this because of shame and different things. What what words of wisdom would you share with someone who is listening to the podcast, who is struggling with these things, and they know that it's not taking them down a good road. They don't want to continue to go down this road, but they're not exactly sure what to do about it, and they're still kind of caught in not wanting to tell the truth. They're caught in their secrets. There's that quote that says, "We're as sick as our secrets." And so I was kind of wondering what your wisdom would be to that listener who's hearing your words
mm,
and knowing that you've walked this path and is really giving you know street cred, right? It's not just, you don't have only, you have all this education, but you have street cred because of what you've walked and you've experienced it. So they're listening to you, right?
I have got the
What
scars,
would
that's
you
true.
say to them?
Um,
Yes.
First of all, it's not a secret. If you have been drinking like a fish, then people know that around you. Okay? There is, if you look at the screening questionnaire, one of the simple questionnaires for the question is, are you an alcoholic? It's called a cage question. Have you ever thought about cutting down? Do you get angry when people challenge you that you're drinking too much? Are you feeling guilty about your drinking? And do you need an eye opener? So there's a classic screening questionnaire there. And typically, the moment you actually think through that and you sort of think, yeah, well, yes, 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 maybe not. Come on. By that time, others have realized that. One of my mentors in the past, he said that when he stopped drinking, people said, "Oh man, I'm so pleased that you stopped drinking." He thought, "Oh, did you know?" And they said, "Yes." And he was a financier, and so he said, "Well, why did you not? Why did you not get away from me, etc." And they said, "You had such ironclad contracts. We couldn't get out of these contracts. Otherwise, we would have run a mile." And it was very intriguing. So people know. So if you think that you're in secret, no. The shame and guilt that keep you there, it is actually bullshit. Because whatever you have done, there are others who have done far, far, far more. And I think that is the
Mhm.
humbling thing for people like you, Dana, and me. I have got my show, Neff Inspiration, which was previously called My Steps to Sobriety. And I've now interviewed about 500 people on my show. Many of them have done things that they were not very proud of. And some of them ended them up in either very severe social isolation or in court of enforced isolation. Uh, and many people lost everything and then some, and they rebuilt themselves. And I think it is so beautiful because these people come onto my show and they speak out. And here I am coming onto your show and we speak out. The sheer fact that we
Mhm.
speak out and that we are authentic, that we are honest, that we show humility, that we show integrity. These are all habits and traits that don't go along with addiction, with mental health. Because the moment you're actually speaking things out, you actually realize, hang on, that sounds like a whole lot of BS. Like, look what they have done to me. And because they have done to me, oh, I drink now a whole bottle of vodka. Ha ha, that will show them. At the moment you spell it out, you think, there's something not right about that. And it's those kind of things. So you come out of your secret shell and suddenly you are able to address your feelings, although that is one of the hardest things. You can address
Mhm.
the bullshit, the warped core beliefs that are running riot in your subconscious. And you can actually start creating different coping mechanisms, different habits during the day that will consistently bring you towards that better human rather than bringing you closer to the relapse or closer to the worsening of depression, closer to the madness of the PTSD symptoms taking over control. You actually have
Mhm.
control. You actually have so much control. And that was one of the things I didn't believe. And it is only nowadays that I see myself really growing, exploding, really. Despite all the recent trauma, I have grown so much because I have been able to focus on improving myself, on learning more about myself. And for crying out loud, I'm 57 this year. So age has nothing to do with it. This year, beginning of the year, I did a course in radical self-compassion. And that was one of the
Mhm.
hardest things I did because in the course you learn how to conjure up your most dreaded emotion. And for me, that was fear and terror, the uncertainty of the future. And
Mhm.
I ended up sitting with that fear in such a way that it was there. My stomach was the size of a marble. My skin was white with adrenaline, and I hated it. And I would have loved to run away, do anything. Let me wash the dishes, to just do something. And no, you
Mhm.
learn how to sit with your emotion. You learn how to sit with that feeling. And that was brutal. I hated that exercise. But after 5 minutes, then we were taught and practiced how to nurture ourselves. We recognized that the emotion, we allowed it to be there. Then we interrogated or intercepted and looked at the emotion, and then we nurtured ourselves. And that's where the hugging comes in and things like that. And
Love that.
this was such a beautiful thing, and that helped me so much because once these waves of neurochemicals washing over you, it is incredibly hard to keep your head straight. It's like a tsunami. You're getting washed away. You're paralyzed with fear. There are so many horrible, horrible flow-on effects, and you can let the rabbit in the headlights. So no. And the moment you practice that, it's called fear inoculation. That's something that soldiers regularly do. They are exposing themselves again and again until what they experience on the battlefield might be only half as bad as what they experienced in their training or in their constant exposure. Once you do these kind of things, you are such an empowered human and such a better
Mhm.
human. So when then the next trauma comes around, you say, oh, okay, yep. Oh, look at that. Oh yeah, my stomach. Oh, that's fear. Hello, fear. How are you? Nice to
I
meet you.
love
It's
it.
good to see you. But right now, please go over there because I actually need to survive. Okay, so just move over there for a moment, but it's nice to see you, and get on with life. And that is beautiful. So if you learn such things, then you actively take steps. You are in control. It's your choice how you react. And it's no longer an subconscious fight or flight, freeze, fawn, whatever response you have to trauma. That is
Mhm.
that is the choice that you have. And you it's like getting fit. It's not good if you try to get fit when the bear is running after you. That's maybe a bit too late. You need to actually, yeah, before you go in the woods, maybe you should learn how to run, and maybe you should learn how to, whatever is your fitness level, maybe improve that. And it's the same with your emotions. So in those times when you actually are okay-ish, then let's see how can you improve. And you
That is
hmm?
I'm sorry, that what you're saying is just absolutely spot on. It's amazing. The fear inoculation, I've taken a lot of my patients through that. I've experienced it myself, and it really you come out of that on the other side much stronger,
Mm.
much more resilient. It kinda reminds me, have you ever heard the term anti-fragile?
Anti-fragile, no.
Mhm. It's an extension of grit. So you have resiliency, and then grit is basically resiliency over time.
Uh-huh.
And then anti-fragile is when, like, resiliency is you keep coming back, right? So something knocks you down and you keep coming back. Grit is doing that over
Mm.
time. If you're anti-fragile, what that means is when you come back
Nice.
stronger than you were when you were knocked down. You don't just come back, you come
Nice.
back stronger. And that's exactly what this fear
Mm.
inoculation can do, because we are sitting there with it and we're allowing ourselves to feel it and realize it's okay, we can deal with that. So we come back. So, like you said, the next time something like that happens,
Mm.
we're like, man, okay, I feel that, but that's awesome and absolutely amazing. I've done it myself. I've taken patients through it. It's an amazing, amazing thing. I know that my listeners are listening to what you're saying, thinking, this is amazing. I want to hear more of what Dr. Neff has to say. So what I have here, and correct me if I'm wrong, is to send them to neffinspiration.com. Is this
That is
correct?
very correct. That is my website where you see all the articles that I'm writing. And I'm not talking about scientific articles. I'm talking about just good decent articles to demystify functional medicine, demystify medical new developments, the how to make it clearer and easier for people to take the right steps, because there's so much bullshit out there. There's so much crap out
Mhm.
there, and by people who are either influencers or just wanting to make a big buck, a quick
Mhm.
big buck, may I say, and
Right.
and it's just hard. So who do you trust? And I think there is no easy answer to that, but there are some resources that are probably a bit more reliable than others, and hopefully one of them is mine. So you have got my show, Neff Inspiration, where I broadcast twice a week some beautiful interviews with wonderful people who are expanding my horizons, who are teaching me things, who have gone through hell and keep going, because then they've come out the other side stronger and are now out there and
Mhm.
saying, I've gone through so much trauma. Let's make sense of that. Let's actually create out of this mess. Let's create a message and turn this this trauma into maybe a dream, and then this dream, let's make it crystal clear, and then becomes a vision, and then let's take steps towards that dream, and it becomes a mission. It's all this kind of change from the victim a kind of role and attitude that we have towards a thriver, towards, and first survivor, but then thriver. And that's that post-traumatic growth. So that's what I'm addicted to. And with functional medicine, that's what I try to change in my body. That's where I try to change physically how I can support myself. So I've been applying, what I walk the walk, not just talk to talk. So I've just lost close to 30 kilogram, just at 60 something pounds. Um, I'm stronger now than I was even when I was young, and it's those kind of things. So the past does not equal the future, and
Mhm.
that is where I'm going out there. For those of you who are watching My Finger Points, My Steps to Sobriety, that's a book I've written, and that is literally over the next 2 weeks is being released in hard copy and as an ebook in the third edition. And that is a lovely starting point for those people who have struggled with alcohol, who are, or with any kind of addiction, because it sort of, it's a little bit of memoir, but much of it is actually giving you the advice how what alcohol actually does to you, give you a reality check, so to speak, then goes through a modern version of the 12 steps that people can maybe easier relate to, and then give you all kind of these kind of training scenarios that we know things will happen. You will experience depression. You might as well learn a little bit about it, and maybe what action steps are good. The practice
Right.
before before you have to run before the and away. How do you recognize a toxic relationship? Those kind of things. So there's lots and lots of help in there. So I hope
That sounds
I hope
fascinating.
there is
Absolutely fascinating.
help for others that are waiting there.
I want to thank you. This conversation has been fantastic. I've heard so much today, and I know my listeners are just going to be they're just so appreciative of what you have to share. Thank you for joining us and spending your precious time and effort and wisdom with us, with me, with my listeners on Phoenix and Flame. Thank you very, very much.
It was a true honor. It was a true pleasure. Dana, thank you very much for creating this beautiful platform where people can truly have a measure of hope, because that's what we really need. This world is a strange place at the moment, and you are a merchant of hope. So, Dana, thank you very much for the platform that you're providing.
Thank you. Thank you, Dr. Neff. So, listeners, I know unequivocally you have heard multiple things today that you're thinking, I have a friend, I have a
Mm.
coworker, I have a family member who really needs to hear this. Take this podcast episode, copy and paste the link in text and email, put it on your favorite social media sites, spread it out there. Let's spread and grow our Phoenix and Flame community so that we know we are not alone. I'm Dana on Phoenix and Flame.